May is National Women's Health Month. One survey finding more than 6 in 10 women struggle with prioritizing their health.
So, on today's checklist, we're going to take a closer look at some of the biggest issues and some of the biggest questions that women face today.
Dr. Elisa Port is the chief breast cancer surgeon at Mount Sinai here in New York. She's out with a new book today called The Breast Advice, All You Need to Know About Breast Health Screening and Treatment. Dr. Port, good morning to you. Thanks for being here. Congrats on the book.
Thank you.
I think when it comes to women, juggling so much all the time, around the clock. So how can we stay on top of those really important screenings?
Yeah, I think what you guys said to lead into this, prioritizing yourself and making a schedule. You know, a lot of women do this around their birthdays. It's a gift to themselves to do all their screenings. Some women do it at the end of the year, Emily, and they say, you know, it's a good time to do it because a lot of women, quite frankly, financially have met all their deductibles. And so out-of-pocket expenses are lower. So it's really just about sticking with it and staying on track on a yearly basis with these scans that we know are so important in these tests. Pap smears, colonoscopy, mammograms. You know, mammograms need to start at age 40 and yearly thereafter. But I go into a lot of detail in the book about there are women who need to start that earlier and understand their risk and know when they should be doing other tests too.
Yeah, I think tying it to a certain time of year, that's a good reminder to be like,
Yes.
oh, I got to get those screenings now. But if I can ask you about something else, I feel like a lot of people are talking about whole body scans. So is this something that you recommend? What should we know about this?
Yeah, whole body scans are very controversial. The one cautionary thing I would say, which is super important, is that they shouldn't replace the tried and true.
Yeah.
They're not as good as mammograms for breast cancer. They're not as good as colonoscopy for colon cancer. So don't let them replace the tried and true tests that we know are important to do.
You know, in the book, and in a way, I guess it's not surprising that you say breast cancer is the most common cancer affecting women. My mom was a 2-time breast cancer survivor. And you say there are the 4 W's to help reduce that risk.
Yeah. You know, most women who get breast cancer, shockingly, have no family history of it. So we're all at risk. And as you mentioned, it is the most common cancer. Weight is one risk factor that we can control to reduce the risk of getting it. Being overweight or obese definitely increases one's risk of getting breast cancer and other cancers as well. Wine is just a euphemism for all kinds of alcohol. We used to say in moderation. Now we know as it relates to cancer, there's really 0 is safer than moderation. So it's something to consider. Walking and working out, I couple together because it's not just walking. You've got to go hard, lift weight-bearing exercises, running, swimming. All those things are important to do to reduce your risk.
Dr. Port, it seems like a lot of women right now are talking about HRT, hormone replacement therapy. Who is that right for?
Sure.
What are some of the considerations that women should?
Yeah, I think it's a super important tool for managing menopausal symptoms. As we started out saying, women are juggling so much. And sleeplessness, hot flushes, all of these things can interfere with quality of life. And so I think hormone replacement therapy should be considered among all women, especially if they have no increased risk for breast cancer. Unfortunately, there is a slightly higher risk of breast cancer with HRT. Risk goes from 10 to 12% in the average woman to 12 to 14%. It's not huge, but it is worthy of consideration. And most importantly, if someone does develop breast cancer or has it, we usually take them off of it because most breast cancers are hormonally fed, and you don't want to throw fuel on the fire, so to speak.
And I want to talk about your book for a moment. One of the things that I love that you did is you're pooling perspective from patients, quotes from patients about how they would like to see advice for the people around them to help them navigate something like a cancer diagnosis. Why was that important to you?
Yeah, I think it's important. So the breast advice is, to your point, not only my medical advice, but it's patient experiential advice. When you've been doing this for 25 years, you've heard a lot of patient wisdom over the years that I've tried to feed forward to other patients. And I think it's really important to share that advice. You know, show up for people. That's one thing that we always say, our patients always say is really important, the people who show up for them. You know, if you've had breast cancer yourself and you're taking another friend through it, Don't say, do what I did.
Yeah.
Right now, no two cases are the same.
Just be there.
And be there, right, and listen, and thank God we've moved past a one-size-fits-all approach.
Yeah. Well, Dr. Port, thank you so much. The breast advice is available now. And for Dr. Port's checklist to take to your next mammogram, head to today.com.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.